to present a novel new vaccine. स्क्रीन शेयर शेयर ये यहाँ पे अच्छा ये हाँ अब स्क्रीन विजिबल है अशोक जी
यस सर
हाँ स्क्रीन आ रहा है ना ठीक है वो नेटवर्क इशू हो गया था सॉरी फॉर हिंड्रेंस सो screen is visible.
Yes sir, screen is visible,
yeah,
sir.
Yeah. So this
Yes.
novel three dose G protein vaccine, which is launched by the Cadila Pharmaceutical Company, first time in the world.
Sorry sir, Mithra sir, sorry sir. Sir, please
Yeah.
video on, sir, please.
Please.
Video on, sir.
Video on. Okay.
Yes.
Okay.
Yes,
So,
yes. Thank you, sir. Yeah, please start, sir.
Yeah. So now proceed. The main purpose of this launching of this vaccine, I think, is because of the compliance. Because the previous WHO approved vaccines have to take 5 doses, and most of the people, I think, 40% people are not taking the complete 5 doses of the vaccine. And considering in this view that Cadila has launched this vaccine, so in future I expect that the compliance problem, compliance issue will not be there for the anti-rabies vaccination. Now comes to what can you do? Okay, this is not changing. Now comes to the our content of our today presentation. So first, I will just give in brief about the rabies disease, about the mode of transmission of the disease, how it is caused, then animal bite incidence is the incidence of the disease or animal bites, current management methods, evolution of rabies vaccine, how it has evolved, this rabies vaccine and other vaccines, current challenges of post-exposure prophylaxis, what are the compliance issues and what are the different studies on compliance, and about rabies, its novel technology, virus-like particle platform technology, then a result of the studies, clinical study, trial study, phase 2, phase 3, and lastly the takeaways. So the disease, the rabies, as you know, most of you know that rabies is a zoonotic disease. That is, the disease is transmitted from animals to man. That is, the disease is primarily of animals, but it transmitted to human being with the bite of the animals, and it is caused by the rabies virus. Rabies virus, it is a bullet-shaped virus, and it comes under the genus Lissa virus and family Rhabdoviridae, and it has 5 structural proteins. It has 5 structural protein, of which you see the N protein, T protein, L protein. So these are the envelope protein, of which the G protein is the major antigen in the formation of neutralizing antibodies against rabies virus. So this in the formation of this rabies vaccine, G protein is taken for the manufacturing of the vaccine. So comes the burden of the disease. So you see that around 59,000 deaths due to rabies there is globally per year, and in India, out of 59,000, 20,000 largest death in India, it is 20,000 deaths per year, of which 91% death is in the rural areas. So you see the disease burden, it is very high from the rabies. And now see the current management. Current management when animal bites, or I want to know you that the dog bite is still it is the main reservoir for the rabies virus, and it accounts for about more than 90%, or you can say it is more than 99% of the animal rabies is due to the dog bite. So the rabies is synonymously said as it is the dog bite disease. So current management of what we do after animal bites. So first of all, I have told that dog is the main reservoir of infection, and it accounts for more than 99%. But other animals can also transmit the disease, like even the cat, rat, rabbit, or any domestic animals, wild animals, they all can transmit the disease. So whenever a bite occurs, then the first management should be the local wound management, that is local wound treatment. So it should be the wound should be washed with tap water, or you may call it flowing waters with soap and water, and then you can apply some antiseptic or antiseptic cream. And next step will be the active immunization. Active immunization means the administration of the vaccines, and the side by side you administer passive immunization, that is rabies immunoglobulin. Not in all cases, there is categories of bites. So first of all, I just brief about the different categories as per World Health Organization has classified the animal bites in 3 categories. So category 1 bite, where there is only leak by the animals on intact skin, and in that case there is no need of any active immunization or passive immunization. Only local wound treatment, local washing of the area is sufficient. And in category 2 and category 3 bites, the category 2 bites is leak of the rabid animals on the mucosa or the abrated skins, uh, or bite or scratch by the animals without oozing of the blood, then it comes under the category 2 bites. And in this case, in addition to the local wound treatment, there is need of active immunization with the vaccines. And in category 3 bites, which includes all transdermal bites, that means all bites or scratches with oozing of blood. If any bite or a scratch leads to the oozing of blood, that is, after bite there is blood is coming, then in that case it is considered as category 3 bites. And all bites by the wild animals also comes under category 3 bites. Any type of bites by the wild animals, category 3 bites. In that case, there is need of passive immunization in form of rabies immunoglobulin. 2 types of immunoglobulins are coming, human immunoglobulin and equine immunoglobulin. So apart from in category 3 bite, all 3 treatment should be given, that is local wound treatment, active immunization with anti-rabies vaccine, and passive immunization with human or equine rabies immunoglobulin. The dose of the human immunoglobulin is 20 international unit per kg body weight, and for equine it is 40 international unit per kg body weight, and it should be injected in the wound, in and around the wound, and rest part should be injected intramuscularly in the other areas of the body. So previously the vaccine given is in 5 doses: 0, 3, 7, 14, and 28 days schedule. So, but so all you know that rabies is a fatal disease. Rarely, I think in history there is 1 or 2 cases which were survived after contacted with rabies. But generally it is 100% fatal, and but also it is 100% vaccine preventable disease. The disease can be prevented with if you take the appropriate vaccine or full course of the vaccine, then you can prevent the disease. So how the rabies vaccine evolved, evolution of rabies vaccine. So first time in 1885, the vaccine first came was the spinal cord vaccine, which is live attenuated vaccine. And in 1911, other vaccine, nervous tissue vaccine, that is the brain component up to 10%. So this is both are the nervous tissue vaccine, spinal vaccine, and the brain up to 10%. So these are the nervous tissue vaccine, and it was needed for the large number of doses. The first introduced vaccine up to 31 doses have to be taken, and second vaccine, which is nervous tissue vaccine, which is to be taken about 14 doses in the abdominal, subcutaneously in the abdominal areas. But in 1976, cell culture vaccine came, and then the number of doses reduced very much, and it is 37, 14, and 28. 5 doses is needed for the vaccination. But there is challenges, current challenges for the challenges about the post-exposure prophylaxis is that the current rabies vaccine are cell culture vaccine, and it is more than 50 years old technology, and it is but there is consistency in inconsistency in potency, stability, and also there is short supply. Many times the supply is very short, due to which there is interruption in the vaccination, and also the adverse event is also a challenges for the 5-dose vaccine. But when this vaccine, 3-dose vaccine came, the challenges or non-compliance can be reduced. So non-compliance is the major issue for the current vaccine. So there is some terminology about compliance, when we call it compliant, and when it's called delayed compliant, and when we call dropout or non-compliant. So when a person receives the full course of ARV on scheduled doses and date, on recommended date, then it is called compliant. And delayed compliant, when a person after completed the doses, full doses, in 60 days periods, and deviated from the scheduled dates, then it is called the delayed compliant. And when a person not take all the doses, or at least 1 dose of ARV after animal bite, and not complete the full doses, then it is called the non-compliant. So there is issue of seen in the already currently vaccine running, and that is the Rabipur or other vaccines, that there is a non-compliance rate is very high. Persons are taking vaccines up to 3 doses, and then the compliance is decreasing very much. So at about 4 doses, it is compliance rate is only 70%, and at and at 5th dose, it is the compliance rate is 60%. So non-compliance rate is about 40% when they are reaching the 5th dose. So every more than one at every 3 persons is non-compliant in current vaccine. So current challenges, you see the 4 injection, 5 injection, there is 30% non-compliance and 40% non-compliant. And 5 injection, the compliance rate you see after at 5% it is 54% compliance. So these are the non-compliance to 5 dose, and that caused the proven death of the patient. So these are the case studies we've seen that due to non-compliance, in all the 3 cases, you see only 3 doses has been taken by the bite victim patient, and that lead to the death. So this is not mainly the non-compliant. There are also other reasons can be added in this case, because lack of immunoglobulin is also a major cause that may cause death of the patient, person in case of stage 3 bites. There is articles published in journal compliance to post-exposure prophylaxis among animal bite patient, a hospital-based epidemiological study in Safdarjung, New Delhi, where 360 animal bite patients were taken for the study, and it has been seen that 53 patients were non-compliant to the post-exposure prophylaxis. Like other studies also on the compliance of the anti-rabies vaccination in post-exposure prophylaxis. Also a study which you see you see that at first dose it is 100% compliant. At second dose it is 88%, third dose 85, 70, and at fifth dose, when you come to fifth dose, the compliance rate is reduced to 60%. So as the dose increases, the compliance rate decreases. So there are constraints for compliance to complete course of anti-rabies vaccine. So it may interfere with school timing. It is in that in case of 11% cases, it interfere the school timing. Distance of the hospital, 11%. Cost incurred, it is the cause in case of 13% cases. It is the cost that leads to the non-compliance. And it is the forgotten dates, 18%. And the loss of wages, which is the highest, that is the 47%. That is the cause of non-compliance in this study, you see. So meeting the unmet medical needs. So this to meet this unmet need of non-compliance or less compliance, the vaccine, that is Travis, introduced by Cadla. So this vaccine, it is prepared, and this vaccine is the first protein subunit vaccine introduced by the Cadla. It is prepared by VLP platform technology, that is virus-like particle technology, it is the first vaccine with 3 doses given intramuscularly on days 0, 3, and 7. And it is better regimen. So this is the Travis vaccine, and now comes to the virus-like protein technology. So here the G protein is used for this purpose, and the G protein is difficult to stabilize from the protein. G protein is taken, which is difficult to stabilize, and the Cadla Pharmaceutical Company Limited has stabilized this protein through VLP technology and purified and stabilized. And it is VLP are similar to the native virus particle. जो वायरस होता है रेबीज का, उसी की तरह होता है, देखने में सेम लगता है, but that do not contain the viral genome. So there is no genome in the G protein, stabilized G protein, and it is and they cannot replicate because there is no genome in the protein complex. So they cannot replicate, but can mimic the viral antigenicity, but have no pathogenic property. So this protein complex having the antigenicity property, that is the when introduced in the body, they can produce the antibody in response to the antigen. But there is no pathogenic property, that is they cannot cause the disease. So this is the technology which come in recent times. In previous vaccines, there may be they may cause the disease, but in this technology, because there is no genomic particles and there is no pathogenicity, so this technology is good for the vaccine production. And original research, there is research also done by the Dr. Smith Poddar, Ashok Agarwal, and they also on novel recombinant rabies G protein vaccine, VLP based rabies vaccine, has published by ACI, that is Association for Prevention and Control of Rabies in India, a journal published by association. So now comes to the result of the phase 2 and phase 3. So in phase 2 and phase 3, in both the trials, there is seen that the side effect of the vaccine is very few, and there is no any mortality from the after the introduction of the vaccine. And the side effects are mainly the mild type of side effect. And if you compare the seroprotection data, so you can see that the 3 doses Travis vaccine seroprotection is equivalent to the 5 doses of the WHO's pre-qualified vaccine, that is Abby or others. So after up to 90 days, but after 90 days, the seroprotection rate of the current vaccine, that is Revipur or others, is reduced, but the seroprotection of the Travis vaccine remains very high, above than the current vaccine. This is the phase 3 trial done by the Cadila pharmaceutical company. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle.
Sir, voice is not audible. Mitlesh sir.
Trial. So, sorry for interruption.
Sir, your voice is not audible. Mitlesh sir.
Yes, audible.
Yes,
Sorry
yes,
for
sir, audible.
interruption.
Yes, audible. Sir.
So if you see the result of phase 3 trial, so in phase 3 trial, the it is the main purpose is to know the inferiority of the vaccine, how as the vaccine is inferior to the current vaccine or not. So the main and the objective also is to evaluate the immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteer. So in this trial, two types of persons we are taken. One is case and one other is control case. That is the total 800 subjects we are taken in the study, in which the ratio is 2:1. That is that out of 800, 533 subjects we are given the novel vaccine, and 267 we are given the pre-qualified WHO pre-qualified vaccine, that is Rabipur. In the regime of 037-14-28, and in the Travis vaccine 03 and 7 days regime. And it is seen the result. Yes. So the objective, study design and objective. So the design is to demonstrate the non-inferiority of the test vaccine, that is the Travis vaccine, to the comparator vaccine, that is Rabipur or other pre-qualified WHO vaccine. So the primary objective was that the subject with seroprotection at 14 days post exposure first dose. के बाद क्या रह पाता है, सीरो प्रोटेक्शन कितना होना चाहिए. So as per WHO, the serum level of more than 0.05 international per level rabies virus neutralizing antibody titer is sufficient for the protection against the rabies. And the secondary objective is subject with seroprotection at day 42 post exposure first dose of the test vaccine, safety by monitoring subject with adverse. So there are two main objectives. One is the seroprotection at 14 days post first dose, and other is the safety and safety of the vaccine, or the safety. So seroprotection, the protection obtained by vaccination, that is the little told, that is the more than or equal to 0.5 international unit per ml. So if you see the result of the vaccine, then it is seen that the efficacy of the vaccine is almost equal in both the Travis and reference vaccine, and that is the 99.24% for the Travis first on day one, and 97.272 in case of reference vaccine. And if you see on 14 days, but if you see on 42 days, it is 100% in case of 5 dose vaccine of the reference vaccine, and 98.69. But this difference is very minimal, and this is not statistically significant. The difference, you see the minor difference after 3 doses and after 5 doses, it is not significant. If you look for the safety of the vaccine, so you can see that adverse event of Travis vaccine is less than the Rabipur vaccine. That is, it is statistically significant. That is, in Travis it is 9.9%, whereas in Rabipur it is 17.2%. So overall adverse event is like this. And if you see the local adverse event like local pain, redness, swelling, this is also less in case of the Travis vaccine as compared to the Rabipur vaccine or reference vaccine. And if you see the systematic adverse event like fever, headache, urticaria, ear pain, this is also very, very less in case of Travis as compared to the reference vaccine. So now conclusion is that the Travis vaccine is non-inferior to the reference vaccine. That is, this vaccine is not inferior, that is non-inferior to the reference vaccine. That is, it is equally seroprotective, but the adverse event, you see the adverse event, it is very less as compared to the reference vaccine. and thus the novel 3 rabies vaccine is safe, immunogenic, and comparable to the reference vaccine of 5 doses with pre-qualified WHO vaccine. So the for this purpose, there is award is awarded to the Cadila Pharmaceutical, the Pharma Innovation of the Year Award, and the Golden Globe Tigers Award to the company. And at last, the take home is that the novel 3-dose rabies vaccine is very safe. It is safe and very immunogenic, and it is comparable to 5 doses of WHO pre-qualified vaccine with better compliance, less adverse event, and convenient to administer, as there is no need of reconstitution. As till now, all vaccines are first reconstituted with diluent, and then only it is injected. But in this vaccine, the vaccine is in a liquid form, and there is no need to reconstitute the vaccine. So there is also convenient to administer, because there is no need to reconstitute. So I think that's all for the vaccine. And if any question you have, then you can ask freely.
Thank you, sir.
Thank you.
All the participants, yes, sir. All the participants can drop their question in the drop box.
कोई क्वेश्चन अभी तक आया है?
I think
Anyone want to ask question?
yeah, I think so. Mithle sir, I have one question.
Yeah.
Sir, what are the signs? Sir, what are the signs and symptoms of rabies in humans?
Sign and symptoms. So at the start, there is prodromal symptoms, maybe the atypical symptoms may be present. But when there is a full-blown disease, there is a hydrophobia, which is pathognomic of the disease. That is the patient fears of the water, and when they drink water, there is a spasm of the muscles of the pharynx that leads to distraction from the water, and they not want to eat, drink the water. And in later cases, even the sound of the water creates a spasm of the muscle, and there is also fear from the sound of the water. So this is the main symptoms of the rabies disease, that is hydrophobia.
Okay.
Yeah.
Thank you. Yeah, thank you. Thank you, sir.
Yeah.
Sir, thank you so much, sir,
So
for the informative. Yeah, thank you so much, sir, for Dr. Mithle, sir, for the informative talk. We truly appreciate your efforts. Last but not the least, we would like to inform you that rabies has won 2 prestige awards in innovation category. So once again, Dr. Mithle, sir.
yes.
Once again, Dr. Mithle, sir, for informative section.
Thank you. Thank you.
Thank you. Thank you, sir. Have a nice day, sir. Have a nice day. Thank you. Okay. Thank you.